President Trump may have signed an executive order ending his administration's family separation policy, but according to the Department of Homeland Security, more than 2,300 children have already been separated from their parents. Child psychologists say this could have profound impacts on a child's development. Dr. Jessy Warner-Cohen joins me now. She is a health psychologist. Thanks so much for being here, Dr. Warner-Cohen.
Thank you.
Let's start, first of all, with the concept of separation, because I think when people hear that, they may not fully understand the critical bond that we know is so essential in those early years for a child. So talk to me first of all about what separation does for a very young child, especially when that separation happens.
Yeah, well, basic needs for young children aren't just food and housing, it's also attachment to a caregiver. For the vast majority of children in the world, that's a parent or some other close relative, but when you're separated from that caregiver at a young age, it can have lifelong effects on how you're able to relate to others and relate to yourself.
And so now you have situations where not only has there been separation, but where there is an institutionalization that's happened in these various detention facilities. What are some of the implications of that, a child being in a detention center?
Well, you know, really these kids need a lot of warmth, and that's the age, especially young children and through their early adolescence. And without that warmth and loving caregiver, we've seen a lot of research talking about lifelong anxiety, depression, trouble forming relationships throughout their entire lifetime, and lots of behavioral issues that may manifest immediately or may take a while to manifest as the anger builds up inside.
Why is that these are such long-lasting, profound effects for things that, you know, happen at a time when some people might say, well, they may not even really remember this experience?
Oh, all of these situations are imprinted on the child very deeply, whether or not they can recall it verbally later on or not. The concept of being separated from the person that you love and the person that you rely on changes the way a person sees themselves and sees the world, and able to understand that.
And so when you have a situation where there may or may not be reunification, for instance, or there may not be even contact with a parent, whether by phone or video chat or otherwise, what does that do then for a child's sense of self and a child's sense of his or her place in the world?
Yeah, that uncertainty is very difficult for children. They need consistency, they need routine, they need to know what's happening. And to not know where they're going to be or what's going to happen, both to themselves and their loved ones, can really be devastating to how a child is able to self-regulate themselves, their emotions and their behaviors.
Yeah, because I think people may not understand, we're not just talking about some abstract sort of emotional thing. There is a physiological reaction that happens, right, with stress hormones that are produced when these children are under this prolonged stress.
Absolutely. These stress hormones, cortisol and the like, really affect both their physical health and their mental health, and leave kids open for risk of diabetes and heart disease through their lifetime, and poor reactions to stress going forward as well.
And so the question becomes, is this kind of damage irreparable? Is this the kind of thing that can be reversed? Let's say these children are reunited with their parents.
Well, the earlier there are mental health interventions, the better the outcome. And so there's been a call today to have mental health services available for these children immediately, to try to start reversing some of the issues that have already been created.
All right, Dr. Jessy Warner-Cohen. Dr. Warner-Cohen, thank you so much for your insight. I appreciate it.